finally, we turn to the question of cervix cancer. It's always difficult for me to talk about systemic therapy of advanced metastatic cervix cancer when I am aware, and everyone should be aware, that this is a disease we should be on the verge of eliminating, period. Whether it's screening to detect it early, which obviously we're now failing at, and of course, the worst situation of all is the question of HPV vaccination, which should have been routine a long time ago. And the evidence is clear that, was it 95, 98% of cervix to be gone. That's for another day, but it's very hard to discuss the enormous difficulties, the pain and suffering, the loss of life for an illness that may not be, should not be. But we've had major advances in the management of cervix cancer. There's no question about a systemic level. As I mentioned earlier, we had cisplatin. Cisplatin has an impact, and with chemoradiation, there's no question in early localized disease, regional advanced disease, we can favorably impact survival, and we had no systemic therapy beyond that. Bevacizumab has had an impact, a positive impact. Immunotherapy, of course, has had an enormous impact, and we now even have second-line immunotherapeutic agents. However, this is a very complex population. It's a population that's younger generally, but often very fragile. Fragile not only because of comorbidities they may have, socioeconomic status leading to nutritional issues, the morbidity associated with the disease itself and its surgical treatments, although that is certainly lessening. How do you pay for these drugs that are coming out? But again, at the level of decision support for the doctors, what is the role of a variety of biomarkers? What is the role of specific immunotherapy? Should they be given together? What is the specific role of bevacizumab? What is the role of retreating with a platinum agent or other cytotoxic agents to potentiate the effects of the immunotherapy? Who is going to conduct the trials that's going to help in the community setting, the real world patient with the comorbidities that would never have allowed them to go on a clinical trial to allow the drug to be in the first place, knowing when and when not to give bevacizumab? These are critical questions. Are we going to pay for all of this? These are issues that need to be addressed. They need to be addressed to help the individual patients, to help doctors make the right decisions for their patients. This is a very difficult topic, but we need to deal with it and discuss it. Thank you.